Welcome in, everyone. We'll get started in just a minute. Just a heads up, we are recording this session for future use for those who couldn't attend today. So just wanted to make sure everyone's aware. Okay, we may give it just like one more minute and see if a couple more folks join, but then we'll get started very soon. Okay, I think we are safe to get started. Welcome, everyone. Thanks so much for joining us for this RFP information session for the Care for Kids and Families request for proposal that we recently released. We're very excited that you're here and interested. I'm going to get started with just a couple of things, and before I hand it over to Mark Fadul, who's our brand new project director for Care. So Joanne, why don't you go to the next slide, please? We'd like to begin with a land acknowledgement, which I will read. CoLab for Community and Behavioral Health Policy and the University of Washington acknowledge that we gather on Indigenous land, the traditional territory of Coast Salish peoples, and specifically the Duwamish tribe. This ancestral land is unceded and must be returned. We also acknowledge that our work across the state takes place on the homelands of Native peoples who have lived in this region from time immemorial. Currently, there are 29 federally recognized and 7 non-federally recognized tribes within Washington state. We express our deepest respect for and gratitude towards these original and current caretakers of the region. As we move forward in advocating for and move towards health and racial equity, let us remember that we are living in a history-driven present. Let us work to learn more about the histories, cultures, and traditions of Indigenous people and how we might build relationships with sovereign tribal nations and create more inclusive spaces that foster innovation, collaboration, and empowerment. We encourage you to consult nativeland.ca to learn more about the land that you are on and to pay rent through Real Rent Duwamish. The Duwamish tribe has yet to be justly compensated for their land, resources, and livelihood, and by paying real rent, you can do something today to stand in solidarity with First Peoples of this land. All funds go directly to Duwamish Tribal Services to support the revival of Duwamish culture and the vitality of the Duwamish tribe. Thank you for listening. So next slide, please, Joanne. Just a couple of logistics. We'll spend the first bit of this going through the RFP and the application. So during that time, please remain muted if you can, just to reduce background noise. And if you have a technical or logistical question, you can put that in the chat and I can try to help you out. During the Q&A at the end, you may use the raise hand function to indicate that you want to unmute and ask a question, or you can send a question through the Q&A at any time. And I'll kind of track those as we go. And without further ado, I'll hand it over to Mark, who's going to take us through the presentation.
Thank you, Maggie. My name is Mark Fadul, and I wish I could see everyone's faces because I guess my guess would be I know a few of you, which is really cool. I just want to start even before background to say something very quickly, and that is, I think this meeting is kind of a celebration. It's a celebration of hours and hours of diligent work done by the community with the CoLab team, um, which many of us have been fighting for this type of work for years and years. And that is, how can we provide culturally responsive care better, especially communities that have been neglected or marginalized. So this is truly a celebration, and a celebration that we're going to need that energy to move forward. And that's what this is really about. So the background, I will read this, but feel free to read it for yourself also. A state-wide initiative facilitated by the University of Washington CoLab for Community and Behavioral Health in the Department of Psychiatry and Behavioral Services. The CARE team is seeking to contract with an organization that's demonstrated experience providing training to mental health clinicians in the culturally responsive care or similar modalities. The CARE project's definition of culturally responsive care can be found in the next slide in the image titled Guiding Principles. Next, please. So these are the principles that, after having many listening sessions and visioning boards, et cetera, came very clearly to us. And many of these principles are principles that all of us have been trying to live with and to reflect. Once again, we really, really want to focus on community voice and partnership. And I think it's one of the reasons why I decided to join this team is I really thought of the university as being top down for the most part and being somewhat disconnected. This CARE and CoLab project is turning kind of that hierarchy upside down, which I think is needed and also exhilarating. Culture change in healthcare. So how do we decolonize what's been going on for years and years? A deep engagement with diverse communities, providers that are open to learn and curious about being adaptive. Being flexible is key, having a sense of safety within agency culture. Clients are active decision makers in their care. It sounds really simple, but it doesn't happen a lot. So that's key. Providers and agencies are accountable to these principles, customer service, and empathetic communication. So these are kind of the gist of where we want to head with the RFP, and also with more than that, with future mental health care in our state. More background. Selected trainer will work closely with the existing multi-sector team to expand cultural responsive care in public mental health services across the state. So once again, we're doing this as a team. This is not for one organization to do all this work all by yourself. We're going to do this together. The current RFP supports the development of in-person and asynchronous training. So we want to make sure that access is key. And so therefore, if web-based is better for communities at times, then we're going to do web-based. Face-to-face, then we'll do face-to-face. The organization will pilot the training, collect feedback, and contribute to training and or implementation improvements. Once again, this is pretty simple. That let's give it a shot. We're not going to get it right the first time. We're not going to get it right the second, third, or fourth time, but we're going to put something out there, and then we're going to collect feedback. We'll take a look, and then we'll take whatever we learn and we'll adapt it to make it better together. The work is expected to occur between November 2023 or as soon as the contract is established, and then December 24th. I'm sorry, 2024. Next. So these are desired capacities, and we know that these are many of the capacities that you and or your agency already live by. So having a deep knowledge and experience of cultural responsivity, credibility in training delivery, demonstrated track record, interactive training style, adaptability and flexibility, inclusive language and approach, culturally tailored training content, practical application of knowledge, ongoing support and follow-up, evaluation and feedback. These are some of the deliverables, and this is what's expected between now and December 2024. Now, our hope is that there's going to be more money available to us mid-year next year. But the reason we're saying this is the funding that the state has offered us. So number one, cultural responsibility training. Collaborate with the CARE training subcommittee. So these are folks that have been on the CARE team for a while and they have been working on this to design training curriculum for in-person and, once again, web-based platforms. The UW CoLab can offer a web-based platform if needed. Once again, I'm stressing there that this is teamwork. Pilot the training, as we talked about, to a minimum of 4 community mental health sites, covering a minimum of 3 ACHs, accountable communities of health, in the region. Number 3, collect evaluation of training using measures in consultation with the CARE team. So we have to get feedback from the community. How did it work? What didn't work? What could be done better? What do you want us to continue to repeat? Number 4, produce a report summarizing training approach and evaluation results with recommendations. So how will we build upon what we learned? And number 5, make all training and evaluation materials available to the CARE team. Next, please. This pretty much summarizes what I just said, but it kind of, what's nice about this graphic is it breaks it down on a timetable. And when I first looked at this, I thought I think this is pretty realistic. I mean, the first 3 months is really about building a relationship with the CARE team and getting an assessment of the organization's cultural responsibility training requirements, collaborate, once again, with CARE to establish curriculum development guidelines. Then in the 4th to 6th month, it's really the development to tailor and design the curriculum. With regular consultation with the CARE training subcommittees for feedback and refinement. Then 7 through 9 it's the pilot. It's pilot the cultural responsibility training at selected sites and then collect feedback. When I say feedback, I don't think any of us are thinking about like a major research study by any means. It's let's get some information from the community. Then in month 10 through 12. What do we learn? How can we refine the curriculum, incorporate updates and modifications, and then plan for regional expansion? Because our hope is, and our deep, deep hope is in year 2, as we have more funding available, that we want to expand to 4 more sites at least. So with the ideal of making sure this curriculum is available to all sites in Washington State. Next, please. Proposal submission. Submit a detailed proposal outlining approach to addressing the desired capabilities, along with relevant experience, training methodology, timeline, and budget. The maximum budget for this phase of work is $150,000. Only one organization, entity, per application. The CARE project is currently funded through the legislature through June 2024, after which the team will seek additional funds for the next biennium. Successful applications may be invited to continue a contractual relationship with the project, depending on working relationships and the mutual benefit with the CARE team. Selection process. Proposals will be evaluated based on the trainer's expertise, experience, training approach, and alignment with the organization's values. Shortlisted candidates may be invited for an in-person or virtual interview. Live or recorded examples of training programs that you have conducted, facilitated, or designed, organized may be requested. Next, please. Budget. Provide a comprehensive budget that includes all costs associated with the scope of work, including fees, training materials, any additional resources required. Once again, the maximum budget is $150,000 for the full scope of work. Confidentiality. All information shared with the trainer during the project shall remain confidential and be used solely for this training. Ethical considerations. The selected trainer should adhere to ethical standards and demonstrate a commitment to promoting cultural respect, inclusivity, and diversity in all aspects of the training. We look forward to receiving your proposals and finding the right trainer to help us strengthen our cultural responsivity. I'm going to get that word right once, I think, and foster an inclusive and supportive environment within our organization. Instructions for applications. To respond, please fill out the application form here by the end of day on October 9th. For any administrative or other questions about the application, you may contact our research manager who opened up the presentation. And there's her email address, and we will do our very best to assist you. Hopefully I didn't spend too much time on those slides. Wanted to make sure we had plenty of time for questions and answers and feedback, etc. If for some reason we don't have information that you're looking for, make sure you leave your contact information and we will get back to you as soon as possible.
Hi, I have a question. This is Chimera with Powerful Voices. Seeing as you included a timeline in the information, do you want applicants to expand on what activities we're going to be or we're expecting to include in our proposal in that timeline? Or do you really just want us to focus on our qualifications?
I believe that without killing yourself, the more detail, the better.
Thank you.
You're welcome.
Connie has her hand up.
Yeah, so from my understanding, are we teaching something that you guys came up with, or are we coming up with the teaching as we go along?
That's a great question. I'm going to actually punt it to Dr. Sarah Walker, who is the lead.
Yeah, that is a great question. So, Mark showed sort of the list of principles. The co-design team has moved into a subcommittee structure. So there's a subcommittee that's going to focus on holding this relationship. There is an initial draft outline of a potential training, but that's why about 3 months is built in to sort of be working closely with the training subcommittee team to land on a shared vision for that. We're obviously really interested in folks who are bringing their own expertise into this. So I want to create space for that conversation.
Jeannie?
Hi, McKinney with Deconstructing the Mental Health System. There's curiosity about, it sounds like when it's time to actually pilot the training, there will be 4 regions that are selected. Is that something that the trainers will be selecting or something that the care team will be selecting?
Go ahead, Sarah. Sorry.
Yeah, again, a really great question. So we have been working regionally already. So those would likely be our preference, recognizing that, again, the intent is to have a collaborative process. So the CARE project's already been working in the with the sort of regional authorities in the Spokane area, the North Sound Skagit area, the kind of Yakima, Tri-Cities area, and King County. But again, if there's a great opportunity to be piloting somewhere else in the state, that would be something we would just look at the pros and cons around with you all.
There's also a question in the chat related to whether or not the organization that receives funding can subcontract with multiple trainers. I believe the short answer to this is yes. I think the primary organization would be contracting with the UW, and then I don't think there's any reason that you can't subcontract, unless Sarah, you know of anything.
No, I mean, this came up earlier and we decided not to sort of put any kind of restriction like that in place. We are eager to be working with an organization that could be a sustainable relationship. So as long as you feel like your trainer relationships are sustainable and our relationship is sustainable, then, you know, I think we're just eager to see what people would propose.
This is Sonam Sherpa from Neighborhood House. I couldn't figure out how to raise a hand, so I'm just unmuting. But my question is, are you able to share with us the curriculum that you currently have that you mentioned that you've created, just so we can get an outlook on what the actual work would look like? Neighborhood House, the care coordinators that are under me are currently doing the Pearls program. And we had worked with UW to, make it culturally relevant. So I'm curious to see what we had an opportunity to look at what the Pearls curriculum looked like. And so would you be able to share that? Thank you.
I would think so. I mean, we would need to ask the members of the co-design team that really took a lead on that so that they felt comfortable with it. But we can certainly circle back and ask, and if anybody's uncomfortable, we'll explain the reasons why. The co-developers of that did include one UDA person, but also a community leader and a peer specialist. I'm trying to remember. So it was a kind of a multi-sector team. So I think we just circle back. I can't think of why. Nothing is occurring to me why that would be a problem, but I don't want to speak on their behalf until we ask. It's a great question. And we could send it to the folks who participated in this meeting.
Thank you.
I think it's my understanding that it's a shell of a curriculum, meaning there's knowing that we were going in this direction, that there's plenty of room for adaptation, for change, for collaboration.
Yeah, we're definitely looking for development, not just adaptation. Danny has her hand up.
Hey, good afternoon, everybody. My question goes back to the application and what we need to submit. Mark, you talked about the more detailed, the better, and I'm trying to get a sense of what that detail would be from the perspective of, for example, you have an organization that is talking to you about training. They're giving you the rundown on who the trainers are. Would you want us to talk about different things that we might use for training, since we're not doing something specific yet because we don't have access to that? Would it be like different things that maybe different people have done for trainings?
Looking at Sarah. That was the pause, like who was going to jump in. Danny, I think you're right because it hasn't happened yet. I think it would bode well to give examples of stuff that has worked in the past, right? And yet, like I said, I don't. This is not like we don't want to make it into a 1,000-page application. Like, give a few examples of stuff that you've done that and why you did it and how it was, received. Does that make sense?
Totally makes sense.
Yeah. And, I love that question.
We know.
Yeah. Yeah. All right. Thank you.
Yep.
No, this is Sonam Sherpa from Neighborhood House again. In terms of funding, would the panel or the committee, is the funding going to be only going to one applicant, or would they at some point, are you also going to be deciding that you would be sharing the fund? Or is it just going to be going to one organization?
Yes, we also discussed this and did decide we would like to fund one organization. And again, if the organization decides to subcontract, we're not saying, we don't have a problem with that. But we would like to be in relationship with a primary organization around the training. Did that answer the question?
Yes, thank you. Thank you.
I'm going to say something that's just basic common sense. All the guiding principles regarding this RFP, these are all the guiding principles for CoLabs. Like it's, what I mean? It's not as if, oh, this is what we're expecting from organization that, is granted the RFP. Now, these are all principles that we strive to live by.
Nucha?
Hi, Nucha Sarwang Barnard Center. I'm wondering about parameters for how many people you're looking to train during the pilot session, as well as in looking forward, like what is this going to be looking like? How many clinicians are you hoping to affect? Yeah, just start there.
So Maggie and Mark will need to stop me in case we actually put something in the RFP. But so, we're looking to pilot in like, one agency per region, basically. Again, that's sort of up to once some things get started that we could be talking about what that looks like. But that would typically mean, trying to get it out to, 15 to 20 folks within the agency, to have to all, depending on the size of an agency in each one of those regions. Over time, our vision for this is at scale. I mean, we're being, I think, not unrealistically ambitious in our hope for the state. And we're actively pursuing policy paths that might look at things like an enhanced rate for clinics that adopted this training package along with the leadership package and new workforce roles. So we're really carving out this one piece to get this piece going and get it right around training and cultural responsivity principles while we're also working on this larger umbrella package. So this year and a half, if the partnership was working really well, we would look at renewal into the next year to continue to expand. And then our hope is that we can actually start to craft a plan for scale, which would be, all of the community mental health agencies, maybe through like a staggered RFP process. But that's all. I can't promise that. that's where we want to go. And that's the avenue that's kind of the avenue we're pursuing through the legislative process right now.
I did add the language from the deliverable list in the RFP. It's a minimum of 4 pilot sites.
Mm-hmm. Yeah,
Uh,
so within each one, 20-ish people probably,
Chimera, you had your hand up.
Yeah, so my question is about the budget that we're supposed to submit with the application. Since the scope of work includes the applicant actually developing the training with the care team, I'm wondering about some line items like training materials. Are you expecting us to estimate the cost of that, since that would largely depend on what training we would be developing?
Yeah, you think like asynchronous versus in-person kind of differences?
Right.
Yeah, we're thinking of the contract being inclusive of all the costs that would be needed for delivering the training. I think it's really fair to say we are open to kind of conversation about that in terms of those costs. Right now, we're working off a budget. We're trying to do a fair amount. And so this is taking kind of a large part of our budget for the next year and a half. So we can't go up really on this budget, but we can be relooking at scope and deliverables. But you should write the budget to reflect all of the costs. Like we don't have another budget we're pulling from for materials, for example. It would need to be included in your proposal.
So yeah, I guess like if your idea is to effectively deliver the training, you would need to account for a certain amount that would be asynchronous versus not. That might be just part of the budgeting process. Danny, I think you had your hand up next.
I have 2 questions. One's a follow-up on that. Is that also we should include for travel, correct? Just in case. All right. And my second question was really more around payment in terms of the timing of payment, or could that be negotiated, how the payment would work for the organization chosen?
Yeah, we're open to both just cost reimbursable or sort of deliverable by, we don't, unless Mark has strong feelings about it, we actually haven't discussed this. So yeah, our goal would be to make it, as painless as we can, which is, I shouldn't even say that because we would have to work through the UW bureaucracy. So there's no such word as painless. We try to reduce some of that as much as can. But on our side, we'll be really flexible with sort of what works with the organization around payment, knowing everybody's working here in good faith and the spirit of collaboration. We just want it to be easy.
Thank you.
Sonam?
Thank you. Question, I think sort of, so in terms of expected deliverables, is there an expected number of clients that we're supposed to work annually or, every month? What is the expectation around that?
So I think, again, I sort of hear this as being similar to Nucha's question around the number of kind of staff providers that we expected to be trained during the pilot, the active piloting. And again, I think we're looking at somewhere in the ballpark of 20-ish clinicians/staff per agency per region. So, it'd be good to see 80-ish folks getting this in the pilot year, that first kind of year plus. Because we know a large part of this is really going to just be developing out the curriculum and the materials and working closely with the team.
Thank you. I just want to reiterate, I think it would be really helpful if it's at all possible to share that curriculum or the ones that you have developed currently. Just I would give, I think, everyone a really good idea on. Yeah, thank you.
Definitely. Yes, I'm sure, because it would impact sort of your thoughts about how much needs to go into development. So it is, as Mark said, it is very high level still. So we are looking for pretty active development of a curriculum. But we'll share that. We'll ask our partners and reiterate the importance of sharing and get back to you all as soon as we can.
Turn the tables just for a second. I'm just curious, and feel comfortable to say something or not. How do you guys feel about this? Like, is it exciting? Is it like, it's exciting, but, or, yeah, love to hear some feedback coming back from what you guys think. And be brutally honest or just honest.
I have an sorry, I'm just jumping in without raising my hand, if that's okay. But I have an appreciation for your openness to us sort of even collaborating what the proposal looks like or what the budget looks like. It's not too rigid. And I also like the fact that, you know, you have 500 words, I think, for one part and then 1,000 words for the other. There are a lot of proposals out there where it's like 3,000 words minimum, which is really hard to write for. So just reflecting that I have an appreciation for your openness and the way that the RFP ended up being designed.
Really helpful. Thank you. Any other feedback?
Well, I would just like to echo what McKinney shared. I think this is really exciting as well. I've been hearing just different things about the community engagement process over the past year or so. And, you know, was very excited to know that there were focus groups and things like that going on, because we definitely want to see that connection between initiatives like this and, you know, the folks who are, you know, most impacted being part of that process, that earlier development process, as opposed to, you know, usually it's on the other side of things where they're just on the service delivery end. And I would just love to see, you know, especially, you know, regardless of who ends up, you know, getting this contract, I would just love to see that spirit of community engagement, you know, carried forward.
I had some curiosity about the issue of mental health and behavioral health, and if that was something that you were even looking for in terms of people having experience with that based off of how it's written.
Such a good question. This is something that I think we haven't discussed explicitly. So I'm now just going to share my thoughts. Just aren't reflecting previous discussion about the focus of this. For a variety of reasons, we have tried to stay fairly focused on children's mental health and community mental health, but that's largely been really for political reasons, because to move the effort forward, it's just about who you have to sort of start working with, right? And but we know we want this system to be more integrated and to stop making these like artificial designations between mental health and behavioral health. And we know these things co-occur and they're happening all the time together. We haven't put it in the application as something that we are going to prioritize. I would suggest, though, in my mind, if you feel like that experience adds richness to the lens you can bring to the application as an applicant, it would be viewed positively. I wonder if that's, Mark, is there more? Does that seem like a sufficient answer? That's just my personal view. And to be honest, this process will go through multiple rounds from our co-design team, and the decision will sort of reflect all that deliberation. So I do just speak for myself on that.
So now, you have another question?
This is Sonam Sharpa. I think I just raised my hand, and I have a question. In what kind of support should the trainer be? Should we be expecting if the agency that's chosen in terms of weekly or monthly support from a mental health expert?
So the co-design team, it does include somebody who is a mental health expert, and that subcommittee will begin to meet monthly. But I would also say that the organization should probably have enough internal expertise to be able to take a lead on the development of the curriculum, because we've already sort of negotiated the time that our subcommittees will spend on the CARE project. And they're there primarily to provide feedback and guidance. But this contract really is about sort of funding somebody to do development. So you would get guidance and support, but you would really need to have enough internal expertise to develop out the curriculum.
Just to, you were asking about feedback, and I think the only thing I appreciate the focus on culturally responsive and affirming care, particularly in mental health. Definitely an area that continues to need the focus. For me, that also includes an anti-racist, anti-oppressive stance in doing this work. And I worry or wonder and worry a little bit about how much what that effort actually looks like. I think because from our own experience doing this work, it's actually pretty, it's quite a long journey for the clinicians engaging in that work. And it has to be held within active communication, reflection, etc. And so time means money. And so if we're thinking about extent or expanse of the training, the cost can add up really quickly to hold that kind of space to do that work.
Man, totally agree. And conversely, if you don't have the amount of funding needed, where does that lead you?
Hi, I have another question as well. If an organization has other materials they've developed or, from other trainings that they've done, that could be a benefit to the work that they may be doing with the care team, is that something that the care team would be open to including? And if so, would we be able to maintain our intellectual property over those specific materials that we're contributing?
Yes, so this is such an important one and also kind of a tricky one. So because our goal for this is scalability, we want we want to make sure that the CARE project efforts, investments are something that can be sort of reliably deployed. We would create an MOU. I would say our default position is just sort of what's written in the proposal, which is all the materials would become freely available to the CARE project. I might just encourage you to think about how some of those materials could inform the CARE project in a way that could be continued to use by the state of Washington while retaining your intellectual property over maybe originating materials. But if there was, you could also propose something else. You know, if you've got some really strong materials, we would take that into consideration. It would just be one thing we'd have to weigh against other benefits in the proposal. Our preference, though, is to have materials that can be kind of used in perpetuity within an agreement around the organization's sort of primacy of place as the lead trainer. And we do have some examples of those MOUs that CoLab has been crafting with other kind of proprietary organizations. And so if there's more questions about that, I'd be happy to follow up with what those look like. We're only interested in them being freely available to the state of Washington, so we wouldn't restrict a trainer's organization or an organization's ability to kind of continue to license them outside of the state of Washington, for example. So we could follow up on that.
Great, that's very helpful. Thank you.
Mm-hmm.
Yeah, there will be like a formal process with the university to make, to develop the contract once someone's selected. So I imagine there'll be some opportunity to get input on some of that language as well from our side. McKinney.
Yeah, so going by a current example, so we have a training right now where the trainers have created the content so they can take the content and provide it how they see fit afterwards, but we also are able to continue using it within DMHS. Is that what you're describing?
Correct, right.
Okay.
So our agreement would extend to the CARE project's use within the state of Washington, but would also restrict anybody within the CARE project to license it for gain outside of the CARE project, and would not restrict the training organization for licensing it in outside of the state of Washington, if we followed the models we've been using before. And so that sounds like it's the same, McKinney.
Okay, one more question. I'm curious about the organizations in the 4 regions that y'all are working with. Are those organizations that have a high population of like Black, Indigenous people of color that they're serving? Is there any particular focus on specific marginalized identities?
Well, so the Skagit North Sound region and the Tri-Cities, sort of Yakima region, obviously have a very high proportion of Latinx, Latina populations that they're working with. I'm kind of less clear about the demographics in Spokane. I know that they have a pretty robust kind of advocacy coalition representing different communities, and then the other region was King County, so we've got kind of high diversity here in terms of cultural background, and that would be one of the so I think that that's some of the strength of the proposal, or the strength of the attempt to try to make something work across regions, is figuring out how to be addressing all of those diverse populations in a way that doesn't dilute the need for specificity as well. It's highly complex, so we're eager to just be partnering with someone on. Right now, I feel like the training principles in that outline are fairly culturally, like specific culturally group agnostic in terms of like trying to give specific clinical recommendations to specific cultural groups. So that would be ongoing conversation. Ninja, your comment is just sticking in my mind and it's just sort of rolling around. And I think the reason that I know for me, I won't, I'm not leading the subcommittee. I'm not involved and I obviously care deeply about this rolling forward and wanted to feel supported. And I just personally feel eager to learn. So we know that folks are out there doing work that's really impactful and you're seeing firsthand what's needed to do the work. So, we have the parameters that we've set. There's an interest in going to scale. Scale's always in competition with time and money, but we also don't want to support something that's going to be impactful. And I just would welcome you to just give us really just, share your expertise about what this needs to look like, what you've seen. And if that means in your proposal, you go down on the sites, but you're proposing something that's a lot more robust in terms of engagement. I think we would want to look at that. We might follow up with questions. And if anybody has a better proposal than that, I'd love to hear it. But I do know that I'm committed to learning as well. And we don't want to support something that isn't going to do the work of change that I think we're all eager to see.
I'm sorry. I was just going to say, I really appreciate that. There are other logistical things that I think I need to follow up on. And I'm wondering if you're all open to having us, if I can schedule a time to speak with you a little bit further about what some of those other logistical things that I might have that could be potential either problems or opportunities or whatever.
Yeah, we're happy for that. I would extend that to anybody who wants to follow up from our conversation for sure. Yep. Maybe we'll talk Maggie and Mark about how to even do that to make it a little predictable in terms of schedules.
Yeah, I think we have gone a little over on time even, but I'm really glad to see there are so many great questions. And we're going to make this recording available, but feel free to email me directly. I think I shared my email in the chat and I can start a conversation among Mark and Sarah's name is not, I sent everyone the same link, so that's why there were multiple Marks.
Oh, I didn't even notice that this whole time. That's so funny.
Yeah, but unless there's any other last minute things, we can close it out.
Thank you all very much.
Thank you.
Stay in touch.
Thank you.